Good morning. And now I would like to explain to you why it is very dangerous to manipulate an organ without any need to do it. I will, for example, give you an organ and a disease, the heart and coronary artery disease. Suppose a cardiologist came with a crazy idea of preventing coronary artery disease by everybody that have a high cholesterol level, say over 230, will go and monitor his heart by a catheter and go through his arteries to see if they have leaks or any deposits from cholesterol. In this case, we will interfere with the normal rhythm of the heart, QRST, and we will find many people will die from abnormal cardiac rhythm and from heart attacks and so on. The anatomy and the physiology of most of our organs are not completely 100% understood. So, as far as the colonoscopy, going through your colon to detect a polyps, and they said this polyps may be cancerous, maybe not. If you go and biopsy a mass that is not a precursor of cancer, like lipoma, for example, and liposarcoma. This polyps is adenocarcinoma, but according to all the research done, it takes a very long time. And if this polyps is not secreting blood, is not active, is not multiplication, is very small, why we go and biopsy these lesions? Because during biopsy we spread the cancerous cells into the blood and they go and show up in the lungs, in the liver, in the kidneys. So if you have a normal healthy 75 years old man or 50 that do not complain for any GI symptoms at all, normal, and he does not have any history in his family, he doesn't show any GI problems like constipation, diarrhea, bleeding, hemorrhage, anything. And why you take this guy and go through his colon and biopsy and starting changing the anatomy and the physiology of the colon? You cannot go and remove predicting that it might, because we had a benign cancer and a malignant cancer, and sometimes a pathologist looking in the microscope have a hard time to determine if this is malignancy or non-malignancy. And if I have 5 pathologists looking in one smear, I can have 4 to 1 or 2 to 3. So what we taking in colonoscopy is not 100% malignancy. And besides, they do not know the difference between diverticulosis and perhaps sometimes you have diverticuli, not diverticulitis. Anyhow, I am using medical terminology because what I want you is when you go to your doctor and you want to steal $3,000 out of your Medicare or your health insurance, I want you to be able to discuss with him the reason to let you go through this very difficult invasive technique. So as I said, we have no reason to interfere in normal function of our organs, whether it is the liver, heart, unless there is absolutely an indication that this is the case. And this is not in colonoscopy, as I said before. I would like, as I said, for Medicare to survey all those people that paid billions of dollars to those doctors. And thank you for Katie Couric, this damn advertise that scared older people to go running to cut their colons and start bleeding and hemorrhage. And I will work very hard to get the light on those cheating and unprofessional conduct of collecting money when you could monitor them with a $10 lab test. Thank you, and I will see you in another video. Hopefully I will be able to show you that sometimes a lipoma and a lipocarcinoma or adenocarcinoma and adenoma, even you say this is malignant, is not sharp 100%. So a colonoscopy in the colon seeing a polyp cannot determine if this a diverticulosis or adenoma or hypoplastic, and he just cut it blindly. So if there is no high susceptibility, there should not be any colonoscopy. Thank you for listening, and I will see you next time.